Hey, this is Dr. Corey Glenn, and I'm going to show you another case. This is just another one like I've posted previously where we're going to do a bone reduction guide, drilling guide, and an interim prosthesis. I just like to videotape these because I do them multiple ways, and there's always some nuances between them that I think is generally helpful for people to watch them. So anytime we do these cases, the very starting point is always to make sure that you get a nicely segmented model of the bone. And so you can see that that has been done here. You can see a nice watertight outline of the bone. I turn this off. You can see how it tracks nicely. Good continuous boundary. And I've got videos on the YouTube channel of how I do that. It's, if you do it the way I recommend on that video, it tends to be about a 15-minute process. So not the quickest thing in the world, but it's not that big of a barrier either. And then once you've done that, you need to go ahead and plan your implant positions. And so I've done that in this case, and I'll just go through a few little nuances about the implants. If I click on these one by one, you can see that they are all oriented vertically. I opted not to do the like an all-on-4 configuration. I've tried to keep them, vertical for the doctor that's going to be doing this case, and so I've avoided the mental foramen. We've kept that pretty much vertical. And if you were to look at these one by one, all of them are oriented within the bone. Obviously, I'm tending to slide them right down this lingual plate. One of the things I know just from experience in doing these surgeries is if you're trying to make an osteotomy and your implant is halfway in cortical bone and halfway in cancellous, it is going to deviate. There's really no question about that. So I really just try to avoid that from the get-go, and I make sure that my implant is within that cancellous bone. That way it's not going to fight me as I try to drill and place the implant, and it's also going to have a better blood supply around it. And so with all the implants, they're more or less oriented that way. We can spin this last one around. Now you'll notice also I've got a implant distal to the mental foramen here, and that's because that's going to help me increase my anterior posterior spread. So if you imagine just having these 4 anterior implants, and the general rule is you can go 1.5 times the AP spread of the frontmost to the distalmost implants that rely on connecting those. That's just not the best AP spread in the world. So when possible, I really do prefer to place an implant distal to the mental foramen, even if that ends up being just a short implant. It's just improving the overall anterior posterior spread. So one thing you might notice, all these implants are 3.0 implants. Now that's not what's going to be placed in this case, but the reason I had them showing that way is because this is going to be done using a direct cut drill approach, and the idea was just to do pilot drills. And so what I always do if I just want to generate pilot hole drills is that I'll plan my implants out to be whatever they're going to be. In this case, it was a 4.3 by 11.5, 3.5 by 13, 3.5 by 13, 4.3 by 11.5, and a 4.3 by 6 millimeter implant. So once I've done that and I've planned them out, I like where they're oriented within the bone. What I'll now do, just to trick the software, is that I'll right click on each of those implants and say replace, and then go and just call it a Biomax 3.0 implant, but of the same length. Okay, so in doing that, what it's going to do is it keeps everything about the depth of placement, the trajectory of the placement in the right position, but it's going to change the implant. And if you're using a direct cut drill approach, remember that would be in your guide panel, in your implant list, you would just be choosing direct cut drills. The direct cut drill approach is going to be a one and done. And so the final drill for a 3.0 Biomax implant happens to be a 2.6 drill, which is basically a big, nice pilot hole. So I've done that with all of these, and that's going to set my depth and trajectory, and then the doctor placing these is going to take it off and just freehand up with their drills from there. Now, why is this implant in particular supracrestal? Because I had a 4.3 by 6 implant, but if I go and replace that, you're going to see in the 3.0, there's nothing shorter than a 10. We just don't make that. So alternatively, what I opted to do instead is just raise the apex of this implant. Okay, so I put the apex of the implant at the same position of where I want the apex of my 4.3 by 6. If I was to measure that, you can see going from apex up 6 millimeters, puts me right there. So that's where a 4.3 by 6 is going to reside in the bone, and all of this is going to get profiled up above that. And so I just put the apex where I want it, and I don't really worry about this because that supracrestal portion is not in reality going to be there. What I'm wanting to do is set the trajectory and the depth of the pilot drill. And with this implant placed where it is, it's going to force the drill to bottom out right here above the nerve. So that's the only reason for that. I wanted to explain that aspect of it. Now we're implants are placed. You can also see I've put in pins. The pins are going to be oriented. If you center in on one of those and look at it, the pins are oriented where the apex of the pin is going to be just touching the lingual cortex of bone and not going all the way through. You don't want to go all the way through with your pins on these cases. There's some bad stuff that you could wrap up around a drill in the floor of the mouth. So this is the general trajectory you would want on your pins in between implants and oriented in that manner. So we'll lock all these down. And now we're ready to make the guide. Now I'm going to do a bone reduction guide, and the bone reduction guide is going to be seated once the extractions are done. And so I can do some quick and dirty extractions here just to get it out of my way. And I can do that in Surfaces panel, click on the blue model, and then hold down the Shift button. And let's just cut these. I'm not trying to do a perfect extraction here. I just want them out of the way. So that we can make our bone reduction guide without those being in the picture. So now you can see extractions are done. Didn't try to get super detailed in this. Now I will say that our guide is going to have difficulty blocking out undercuts if I leave a big ledge. So I can see that tooth right there is really angled distal or lingually. I'm going to go ahead and cut a little bit more of that off. And perhaps right there too. And you could also do this in Meshmixer. It's just, you know, kind of unnecessary, frankly. Cut tool works great. So now we're ready to make a guide. Now I'm going to go into the guide panel. I'm going to designate which one I'm building this on. I'm also going to hit the little gear icon, and we're going to change our guide thickness from the default of 3 down to 2. Okay, now why do I do that? Because with these bone supported guides, they can be pretty difficult to slide underneath a flap. And so reducing that thickness on it can really help with that. So sometimes I'll even go 1.5. And let's say remove undercuts. I want to show you something about the removing undercuts. So if I come up here and draw the curve, so I'm just holding down the Shift button, coming around, and let's create a surgical guide with those borders. And I know this is not a perfect curve or anything. I'm doing this to illustrate a point. We'll save this. So here's the resulting guide. And the reason I did this is that we blocked out undercuts, obviously, so that this thing would be able to seat. But one thing I don't love is that just given the trajectory of this mandible, you can see how much it had to block out. Now this is going to be, you know, not the most accurate thing in the world because there's this huge gap in between the teeth and the bone. The reason for that is because in surgical guide mode, we don't have the ability to set a path of insertion. This path of insertion is always defined as coming straight from like the top of the head or from the bottom of the feet, right? It's always going to be in this perfectly vertical axis relative to how you initially brought your blue sky plan, or I'm sorry, your cone beam data in. This is one of those scenarios where I would really like to do better than that. And so I want a more defined path of insertions. One thing is I could just say, don't remove the undercuts, leave them in. And then I could print this bone model and adjust it in by hand, but it's a little more imprecise. Or alternatively, what I could do is exploit the denture module, because the denture module does have the ability to set a path of insertion. And so at least until we put that function in the surgical guide, I'm going to jump over to the denture module and create a model that has a path of insertion defined in the direction I want, which is going to be more this direction right here, kind of the direction of what those teeth are. So let's go and do that real quick. I'm going to go over to Module, Denture, And now you can see we've got the model here ready to go. In order to do this process and to start making a denture where you can set a path of insertion, you've got to put some teeth in there. I know I'm going to be placing teeth eventually anyway, so let's go ahead and just throw a chain of teeth into this of what our interim prosthesis is going to look like. I'm going to opt to use the Mitchhurst Flat Anatomy Library. I'll select all the mandibular teeth, but then I want to do a shortened dental arch, so I hold Control and left click, and I'm going to get rid of second molars and first premolars. Now add these selected teeth as a chain, hold Shift, left click to drop them into the case. Now you're going to see obviously I've got looks like some ortho extractions were done here. We need to chain those teeth up and generate proximal contacts. So if I just hit this button that says mark these visible teeth for a chain, now show and hide that tooth chain, it's going to pull these things together and generate a tooth chain for us. Now I'm going to pull the whole dentition in to its approximate orientation, and I could turn on, there happens to be an STL in this case, and so I can reference this because I know the occlusal plane is pretty good. It's approximately what it needs to be. So just based on the mandible, looking at the mandible, this looks like a perfectly up and down orientation. The incisal position is going to end up somewhere between the tip of this one and this one. So that's probably a good incisal position. And then your occlusal plane, since there's no bite rims in this case, I'm kind of guesstimating, but you know your occlusal plane wants to be from incisal edge to 2/3 of the way up your retromolar pad. And so when I do that, this is looking pretty good. So that's a really quick and dirty setup. And I could do one other thing here. If I go back to denture module and hit the tooth chain again, I like my incisal and canine positions, but your occlusal plane wants to be from canine tips through your buccal, or I'm sorry, your functional cusps should be right in line on a line from canine tip to retromolar pad. So it looks like I could move the tooth chain just a little bit to follow over the ridge slightly more, and same process over here. And that's really all I need to do for a tooth setup. Okay, we'll come back to that later. The teeth is really not what we were after at this point in the process. We're just wanting to generate a model that has a path of insertion. So here's what we're going to do. We're going to now say we're building this denture on the bone model. It's going to be a mandible. Now create denture. And the very first step in the case is going to be to define an axis of insertion. Now ultimately I think we'll incorporate this into surgical guide mode, but again, until then, it's nice to be able to jump over and do this. So here's how the software defaults to make a surgical guide. Again, straight from the top of the head or from the bottom of the feet downward. And when you do that, you see how much undercut we have. That's why we ended up with those big gaps. In this case, what I would rather do is I would rather set a path of insertion more in line with these anterior teeth. So let's come slightly from the anterior. And now as we do that, you can see that it's much less undercuts right in here. You're going to have a more stable surface that indexes more appropriately on the buccal bone. It looks like I might have gone a little too much because there's significant undercut on the lingual, so let's back that off just slightly, maybe right there. And that to me looks like a really good match. And what I want to do is I'm going to build a model here that has those undercuts in that path of insertion already blocked out. And that's what we're going to make the surgical guide on, rather than depending on the default path of insertion. So I like this, and I'm going to tell it that I want to allow undercuts up to 0.1. If I zeroed that out, it would be no undercuts. I actually like just the tiniest bit of an undercut to give it a snap fit, and 0.1 tends to be a pretty good amount. So we're going to allow the undercuts to that point, and now just click next. And as you can see, this is the model that it's going to generate. So now, as opposed to having a path of insertion from up here, it's coming from a little bit more anteriorly. Now that's all I need to do at this point in the denture module. So back to surgical guide, and let's go and start making our bone reduction guides. Okay, so this is going to carry over. Now we've got this as a model on here, and I'm going to call this model 0.1 undercut or reduction guide. Okay, because this is what I'm going to build my reduction guide on. So now to surgical guide. And this time when we go into this gear, once again, 2 millimeters, I don't want to remove undercuts because this model's already had undercuts removed. So we're going to keep undercuts. Okay, so uncheck that. Okay, and let's lock the implants. Notice no tubes are turned on. That's because this is not for a drilling guide. This is for a bone reduction. So the only implants that I want turned on right now are the pins. I do want this bone reduction guide to be able to pin in place. So there's the pins, as you can see. Now we can draw the guide perimeter. So mandible, draw curve, and I overextend these. Okay, when I do this, I basically make a line from mental foramen to mental foramen, and then I really keep it deep. I go up and around as far as I can. And the reason I do that is because I know that I can always go back and trim the borders of these guides down. But if you leave it too short, then in the next step where you're actually making cuts, what you can end up with is a really, really thin, flimsy piece that's very easy to break during surgery. And I don't want to do that. I'd rather adjust it in by hand after the fact. So now edit the curve and create a surgical guide. Push save on here. Okay, here's the resulting guide. And we're going to exploit this to become our bone reduction guide. So to do that, I'm going to go back over here. I'm going to turn that guide off. On our surgical guide, we need to turn the transparency up so that we can see our implants underneath it. So there's our implants, and as you can see, it's evident where those are now. Let's go and turn our bone model on, and we want to also turn the transparency up on that so we can see the implants underneath it. Okay, so maximize the screen. Let's zoom in here. And what we're going to do is we're going to take some cuts at this bone. So in your surfaces panel, there's a button here that says cut all. We're going to use that button, and we're going to position our bone cuts to be right in between the head of the implant and the bottom of the guide tube. Okay, that's going to allow for a controlled amount of reduction, but still keep our implants maybe 1 to 2 millimeters subcrestal, which is how I prefer to do it. Let's also take a look at where our tooth positions are and verify that we're going to have adequate restorative height there. So if I turn the teeth back on, remember for hybrid, you would want to go maybe 15 to 18 millimeters. And it looks like, you know, from here, we're going to have 20 millimeters. So we've got more than enough space to do really anything that we want restorative wise. So I'm just going to delete that and get rid of it. Okay, so back in your surfaces panel, with this window enlarged, teeth turned off, we're going to look from the lingual, and I'm also mindful of where my pin tube is underneath there. So I'm going to get more or less in the same plane as it, and what I'm going to do is now use the cut all tool. Okay, it's important that you use that because you need to make simultaneous cuts that are going through the guide and through the bone model underlying it. Okay. Great. So you can see there is our bone reduction guide beginning to take shape, as you can see. Let's repeat that process now on the other side. And again, I'm going to try to get parallel. I'm looking at this and I want to make sure that my cuts all stay relatively parallel to one another. So I'm going to look at that in the same plane. This time orient a little bit more from this direction where I've got good access to this stuff, and I'll do the exact same thing. Cut all, and I'm going to swoop in right here. and then try to align through my previous cut on the other side. So there's what I've outlined. Let's cut it. And now you see the completed bone reduction guide. And I'm always mindful of, did I accidentally make any cuts on the guide tubes here? And it appears that I did not, so that's good news. So here's our bone reduction guide that's completed. It still pins into place. This will go on after the extractions are done. It should have no problem seating because there's only a 0.1 undercut. Remember, that's how we made this one. And it's a significantly lower amount of space that's underneath this guide as compared to the initial one. So this does go on easily. It's got a path of insertion, but it's minimized the blockouts. It's only allowed blockouts or undercuts to 0.1 millimeters. So we're finished with the bone reduction guide. You have a lot of STLs in these cases, so label them as you go. Can't type today. Too much coffee this morning. Okay, so we see that, and again, after the fact, once this has been printed, we could go back and we could trim on this thing a little bit and allow it to go up and over that mental, or if it's just driving you nuts and you have to do it now, you can go in and just use your cut tool and maybe come up and over that. Come over here, do the same thing. Now that's the point I was making earlier, is that if you don't have your borders extended pretty far, when you made that cut, you might have ended up with only a bridge, whereas mine here is pretty thick. You might have only ended up with, let's say, 1 millimeter or something in space, and that's not ideal. You don't want to do that. So do a little cleanup on this if you want, but you can certainly just print this thing out after the fact and do your cutting on it at that point. So now we're ready to make the surgical guide. Okay, so we have this model now of what the jaw is going to look like, and I labeled this as the reduced jaw. Okay, because that's the model of the jaw, what it's going to look like once bone reduction has been done, right here. So this time we can turn on all the implants. Same thing as last time. We have got this model now, but it's going to force us to make a path of insertion straight up and down here. If you don't want to do that, go back and create that new path of insertion model in the denture mode again, but this time create it out of this model, and I think you'll find that to fit. This one's not terrible, so I'm just going to go forward with it and just make it with the default path of insertion. So we're going to build this on the reduced jaw, locking the implants. Thickness, this time let's do remove undercuts, and let's make the guide thickness 2 millimeters. And now I can draw the curve. Once again, on these I typically go from mental foramen to mental foramen, and then I go up and over. And I don't have to go near as deep with these, because I know they've got that crest to rest on. So now come back down and then edit that curve, and let's create the surgical guide. And again, this is where you got to make sure that you've chosen which kit are you using. I'm using direct cut drills here, so that's already selected. So all I got to do is push create guide. Okay, you see the resulting surgical guide. Again, label it. And I usually call this the drilling guide. So we've got all the guides, and the last thing that we need to do is just build the prosthesis. Okay, so what model are we going to build the prosthesis on? Well, if we build that straight onto this model, then what's going to happen is that the underside of the denture, because we're going to just design a little horseshoe denture on this, the underside of that is going to be resting straight on the bone surface, and we don't want that. We've got to leave some room for tissue. How much room for tissue? In a mandible, I find it tends to be around 2 to 3 millimeters. And so rather than that, I'm going to go one more time and I'm just going to make a surgical guide. No implants turned on. I'm going to go back to the blue model. You just push edit curve, it's going to bring up whatever your last curve was, and this will work just fine. If I want to create a 2 millimeter tissue gap, then I would go right here with a 2 millimeter thick guide. Let's make it 3 here. I'd rather leave a little bit more space and then be able to add material to the bottom side of this and now create surgical guide. Okay, there's the guide. I'm going to label this one tissue spacer, because this is what's going to create the space. We'll build the denture on this and it'll create space to put your hybrid on and not be impinging straight down onto the bone. All right, so we're finally ready to make the interim prosthesis. Let's go to module, denture. Okay, I'm going to turn off this model. All right, and let's turn our teeth back on. So unfortunately, I got to turn everything on and then go back and click my way off of the surfaces I don't want. So visibility, guide visibility, other guide visibility, bone visibility. Lots of models in these cases. So now we have our tooth set up. And if I turn on the implant positions now, actually I forgot, I don't have the implant positions turned on, but that's okay. I had referenced those earlier and they were coming out in appropriate positions for the implants. And so now let's just go ahead and make the hybrid. So this is going to be a denture made on the purple model, which is our tissue spacer, in the mandible. Restart the case. It's going to ask for a path of insertion. That looks good. We're going to eliminate any undercuts. That's the model that's going to be, denture is going to be built on. Now we need to define the denture base. That's going to be done by just holding shift and clicking your denture perimeter. Not trying to make this thing with huge flanges like a traditional denture. Rather, we're going to go just around on the top of the ridge. And here again, I know I'm going to be able to trim on this thing once I 3D print or mill it. So let's don't go crazy on trying to get perfect shape to the flanges and all that stuff. It's easier done, I think, chair side after you've done your pickup. So just a nice flowing margin to this. If you need to add any dots, you can do that. I tend to make these where they have a little bit more thickness on the lingual, because especially if it's going to be 3D printed, it can have you know, some issues with overall strength. So let's give it a pretty generous border on the lingual. Again, easy to thin back if necessary. And let's say next. And here's the initial gingival proposal. Now this is so much better than what we used to have. I'm actually running a beta right now that I'm testing, and so you'll notice that there's a couple of steps eliminated from the version you probably have if you try to do this today on the day I post this video. But much less trimming and everything to do on our initial proposal with the gingiva. So I find that it might just slightly over or under build you know, the thicknesses of the gingiva, but overall it's much quicker. So I just have to do a very minor amount of digital festooning. Pulled the wrong direction. You kind of always, when you're doing this, you want to pull from a lateral view so you can see slightly better. I'm going to smooth the gingiva. because this is going to get some gingival composite added to it. So I don't need to really do a super detailed gingival festooning. I just want a nice, smooth, flowing contour to this. And then on our local deform tool, I like to make, again, this lingual area pretty thick, okay? Because that's easy to trim back, but if you leave it too thin, you really run the risk of having a weak and brittle restoration. So pretty thick here. There we go. And if you see red areas like that, you're going to have to resolve those. So I'm going to just come in with my smooth tool, and usually just hitting it very briefly with the smooth tool will take care of any of those problem areas with the mesh. Just smoothing it really nicely. Keep it pretty symmetrical, and so make sure there's about the same amount of buildup on either side. Not terribly concerned about that because, again, this is going to have gingival composite added to it. So last thing is maybe pull out a little bit more gingiva supporting underneath that tooth. And now we're cooking. This is it. So resolve that little spot. And now we can proceed. So let's, the teeth offset, that's the amount of slop space or cement space between tooth, if you're going to print it separately, and base. We'll have the option of doing monolithic. We don't need a denture tooth reduction coping. That would only be if we were, using conventional denture teeth. So I'm going to finalize. Okay, here we go. This final result. I turn the visibility of that off. You can see now the big picture is this is our hybrid sitting up and over the mandible with a uniform 3 millimeters for the tissue to reside in. And we've got lots of different surfaces. We've got this denture, which is the final base, and this is the one with sockets in it. Okay, so you could print all of these teeth in one big horseshoe out of white. You could print the tissue portion in pink, bond them up, or if you don't want to do one with sockets, which I probably will not in this one, you could print this one, the denture base that does not have the dash fin or final. Print this one and all the teeth, export those simultaneously, and then print that as a monolithic chunk. So let's jump back over to surgical guide mode, and I'll just show you the exporting of this stuff. Okay. While I'm here, I may as well export them both ways. Maybe I decide later on that I want to do this with the teeth, being a separate color. So go to File, Export Data. Let's first export a monolithic one. So a monolithic one would be composed of the denture base, not the final, but the denture base, and the teeth. Now, whatever is visible on the screen, that's what's going to be checked on by default. So I'm going to export this. It's going to take we'll label this monolithic. Hybrid. Let's go back now and export a version that has the teeth as a separate thing. So the teeth are checked on. I want to do those with no surfaces here. This I'll call tooth, horseshoe. And a separate file of the base. No teeth checked on this time, just the denture base with sockets. Call it socket base. There's our files. Let's go look at these in Meshmixer. So here's my tooth horseshoe. I can absolutely print this monolithic. In fact, let me launch Rayware. You'll notice these are individual STLs, so you could, I guess, spread these out across a build plate and print them individually, but if you'll do this, if you'll just pull in the entire horseshoe of teeth, then when you build supports under that, and I would suggest you orient the occlusal surface to the build plate. If I print like this, the result is that everything gets connected and its orientation maintained with one another via the base that's down here. So I'll be able to pull this off and just handle it like one big horseshoe, and it will absolutely drop perfectly into the base that's been created. Okay, so that would cost, let's see what that would cost. In Crown and Bridge, MFH and bleach shade, that's going to take 1 hour and 20 minutes to print at 50 microns, but 100 microns is more than sufficient. So 46 minutes to print the teeth and only 7 milliliters of resin. That is not a lot. Back to Meshmixer, we could import the sockets. Don't want to shift the position. Here's the denture-based sockets, and you see why is this here? Because we designed this because you don't want to have to go individually dropping teeth into it. You would ideally like to see this whole horseshoe of teeth be able to drop in vertically into this, and so that's what you have here. A single base that you can 3D print together, and finally you could do the entire surface, and we called that one monolithic hybrid. So if I turn the teeth and the sockets off, now this one is just the monolithic piece, and we could print this up. Okay, so the last thing that we might want to do is if you don't want to have to just sit there and do a pickup by holding this thing and trying to orient it into the right position with the occlusion and all that fun stuff, what you may want to do is create some pickup holes. So I can do that by exporting the abutments. So let's export data. I'm going to turn off everything except for the abutments. Okay, the abutments, I've made those things be custom abutments, 5 millimeters in diameter, with the intent of being able to subtract those later on from my hybrid, creating 5 millimeter pickup holes. All right, we have the abutments. Let's import those into our Meshmixer case. This is the only step really where you got to jump into Meshmixer. These are the abutments. New. There they are. You can see them protruding all the way through. And I do find one little step here that will expedite this. Historically, I would go now and separate these all into individual STLs. But what I'm going to do here instead is just go to Edit on our abutments, make them solid. It decreases the quality of the mesh slightly, but you can see it's still very acceptable. Let's accept that. I'm going to also do that with the tooth hybrid, the tooth horseshoe with the base. So I'm going to go to Edit, Make Solid. Watch the degradation of the mesh when I hit this. I don't like that detail. That's not good enough detail, and that's because it defaults to do a fast making of it solid. I want to preserve my sharp edges, or accurate is a good one. I can maximize the solid accuracy. Let's increase the mesh density slightly. And here you see it's been made solid, but no noticeable degradation in the mesh quality. I'm going to accept that. And so now let's, in our objects browser, select the solid hybrid and then hold Control and left click the abutments that have been made solid and then do a Boolean difference. So great looking reduction there. Uncheck this button where it says auto reduce result. And now you can accept this. Great, and what I'm going to do here is save this. I save every step along the way. We'll call this monolithic hybrid with holes. So that's all great. We've got a hybrid now with holes, but how do we orient this in the mouth, right? We've got a jaw down here and we've got nothing but space. And it's very easy to over or underseat this and alter the vertical dimension and the occlusion and all that stuff. So the way I'm getting around that is that I'm exporting my reduction guide. So let's go to File, Export Data. I don't want any of that stuff or any of this stuff or any of this stuff except for the bone reduction guide. There we have it. Now in Meshmixer, I'll import that. And here we see it. And what I do is I like to use this for purposes of orienting this base into the right VDO. And that's very simply done by just coming and using a small spot size of about like that. We could smooth the boundary on that and then push T for transform. And let's just pull that into this. All right, except I'm going to repeat the process over here. Select, smooth boundary, T for transform, pull that until it connects. And then I like to do one on the lingual, one on the buccal down here. So that could be in the form of something up on this edge. I refer to these as a sacrificial support. Notice that this one's in between those two holds. I refer to it as sacrificial support just because once you've done your pickup, it's served its purpose. Sacrifice these, cut them off, and that leaves your hybrid oriented into the right position in space. Okay, if you end up with a little crease in your mesh like that, you could double click all that and say smooth. And hopefully that will resolve it, or alternatively you could go into your brushes, robust smooth, and knock that out. All right, so we got these tripoded things. Earlier I failed to notice how I got this. I didn't notice that my this surface was still selected, so when I drug this part up, it drug another piece of this. Always go in clear selection before you do your next transform. So as is, I need to fix this real quick. What I'll do is I'm gonna circle this part, and then with that circled, I'll come over and say Edit, Plane Cut, and the plane cut in this menu, oops, undo back. We need to flip which side it's discarding. So that fat arrow right there, now it's discarding this half. The fact that I circled that and selected it first means that that plane cut is only going to take place on whatever has been circled. So I didn't want to plane cut all this junk down here and lose that. So now we're all good. Let's combine these two files. So Control, Select, Combine, and let's export it. Run an analysis, make sure there's no problems in the mesh. That looks good. So export, indexed, hybrid with holes. That's it for this case. All that's left to do now is the printing and then do the surgery. So once you print it, you could add a little gingival composite or not. You can maybe wait and do that at the time of surgery after your pickup's been done so that you don't have blood and all that junk all over it. So again, same idea as previous videos I've shown. This stuff is not that complex when you break it into its component steps. It's just a lot of individual steps. So hope you found that helpful, and let me know if I can help.